Okay, I started. Um, for my transcultural understanding synthesis project, I focused on the experiences and health-related beliefs rather, of Vietnamese Americans, particularly for the first and second generation. This project argues that Vietnamese Americans' health beliefs and practices are shaped by a complex interplay of immigration trauma, traditional healing methods, and family hierarchy. Culturally, and the tensions of bicultural identity, factors nurses must understand to provide culturally attuned and respectful care.
Thank you. For my project, I focuses on the immigrants' family from South Korea facing significant barriers to healthcare access due to the financial instability and language limitations, highlighting the urgent need for the systemic reforms that ensure equitable healthcare access for all the individual, disregarding the socioeconomic background.
Mm, correct. I think we have something in common about like we're both focusing on like half Koreans, half
Yeah.
of an
Uh-huh.
ethnicity. Yeah.
And
Okay.
also like immigrants community. Yeah.
Yeah, yeah.
Let's move
Uh
on to the second one.
yeah. To learn about this culture, I conducted a conversational, semi-structured interview with a second-generation Vietnamese American woman. She served as my primary cultural informant. I learned about her upbringing, her patients, immigration stories, family traditions, healing practices, and experiences navigating the healthcare system. Since my audience may not be familiar with this assignment, my method can be summarized. I spoke directly with someone who grew up immersed in the culture, listened to our stories, and compared them with scholarly description of Vietnamese cultural practices.
For mine, I used the course textbook on transcultural nursing, which provide a framework for understanding the cultural dynamics at play in healthcare settings. Additionally, I supplemented my knowledge through interviewing with the immigrants from South Korea, who share her experiences regarding the lack of health insurance during her childhood and the stigma associated with government assistance. She discussed the struggles with accessing healthcare, revealing the shared frustration regarding the U.S. healthcare system. With the relationship, I focus on trust and rapport. I approach the conversation with empathy, listening to her experience without judgment. This allowed me to gain deeper insight into challenges and perspective on the healthcare access.
Yeah, I think we both use the same questions to ask our peoples. Um,
Yeah,
yeah. One of the most vivid stories my informant shared was about the traditional healing during her childhood. She recalled, my mom used a lot of holistic remedies such as ginger tea, lemon rice, porridges when she was sick. She also said that her mom used a tiger balm or eagle brand oil to perform some scraping technique using a coin. She explains that she would scrape her back for circulation. This is directly a quote, Jenny H. Personal Communication, November 5, 2025. I feel like this is very similar to some of the traditional practices I've heard from Mexican people as well. So it's really nice to see how our culture played a lot in healing for her.
yeah, thank you. So I was really fortunate to interview one of the immigrants from South Korea. So at age 9, her name is Amy. She arrived in US with her family. Comforting her harsh reality, financial instability. She mentioned that health insurance was a luxury for our family, where she said her parents paid significant emergency costs out of pocket, where she was not even given information about access to free health insurance for low-income families. She envied her friends, where she mentioned that I was jealous of my friends who could get their teeth cleaned at the dentist or visit a primary care physician for checkups. For us, those were luxuries. The language barrier, leaving the family without the proper health information, she said, I remember developing a severe allergic reactions to plums, and my dad had to use part of the small savings to take me to the doctor, even though he cared for my health. It was huge, large cut in their savings. I tried my best not to complain. So Amy grew up without health insurance until age of 21 when she finally learned about free health care programs. However, the stigma surrounding the government assistance was disheartening. She mentioned, while working, I faced prejudice for calling out sick with a doctor's notes. People say she goes to get care whenever she feels the need because it's free for her.
Mm,
So ongoing challenges with her after securing a job with health insurance, Amy faced high deductibles, where she mentioned she was charged $400 after partial coverage for A1C blood work. Yes, the Obamacare is active, but many American families, immigrants cannot afford it. With all this, we could kind of see her conversations where she recognized ongoing struggles with her community, where many even cannot even afford the basic hygiene products and rely on funds for necessities. It's really disheartening to see how many have lost faith in the government's ability to protect the citizen well-being.
Yeah, and it's very sad that people think that she has free health care, so they think she can just get care with
Yeah,
insurance when we
it
know that
just,
that's not really the
uh-huh,
reality. Um,
right.
For my person in a community, healing knowledge is largely held by the mothers, grandmothers, and older aunts. These women carry both traditional remedies and cultural expectations about care. Knowledge is transmitted informally through observation, repetition, and stories. Living in a dominant Western culture also creates shades of tension. She frequently described living in the gray area between the two worlds. In Vietnamese spaces, she wasn't seen as fully Vietnamese, and in American spaces, she wasn't seen as fully American. Language barriers during her father's health crisis also added another layer of stress when she interacted with the health system. Potential Potential areas where she feels like there will be clashes is like dismisses attitudes from her family towards health and Western providers overlooking our cultural practices. Although she says that they still thrive and they try to blend the traditional Western healing practices.
Yeah, I kind of go along with like Korean traditions where Amy while interviewing with Amy she kind of mentioned like family tradition where people share insight about remedies like traditional practices and importance of preventive care which
Yeah,
may not be recognized by the healthcare providers
yeah,
like especially for like Korean immigrant family like functioning with the dominant social culture system can be challenging where limited English professions restrict access to information and healthcare services leading more in confusion and missed opportunity for cares and
mhm,
also like long wait times for like general practitioners and limited availability of affordable healthcare options create like significant barriers and
mhm,
also like lack of understanding of respect for cultural practices and belief in like mainstream healthcare can lead to distrust and reluctance to engage with the systems
yeah,
but I feel like still with all the challenges, like they kind of immigrants kind of rely on each other for support and
mhm.
kind of like being aware of their rights and programs they advocate for healthcare access, creating a push for the systemic changes.
Yeah, yeah, I agree with that. I feel like for my person, Jenny, several cultural dimensions were central to our experience. She talks about our family structure and kinship. She emphasized that Vietnamese families have like a lot of respect for elders. There's a collectivism, there's like hierarchical relationships. Gender roles are particularly pronounced, she said, as she describes like our mom is very submissive to her father, and after he passed away, she felt like our mom lost herself and she couldn't really have a proper way of living. She doesn't know what she loved to do because she was so submissive and in tune with her father's needs. She also talks about like the language and communication. She says that plays a big role in her identity. She still speaks Vietnamese language, but she describes it as not being as fluent enough to communicate with her families in Vietnam comfortably. She describes that her English language became dominant, creating experiences of like creating distance rather from experiencing deeper emotions as a Vietnamese. For her religion and worldview, she said, although she was raised a Buddhist, she now identifies as being agnostic. She continues to tell her family that this is her beliefs, but contrary to what the American society will support in individualism, they dismissed that, and she said, they just like emphasize the cultural expectation of religion.
Yeah, thank you. So I was really able to relate to that since like they Amy also kind of mentioned the kinship and social factors where kind of like highlight the importance of social constructions with the family and the community support, revealing how kinship influences access to resources like the reliance on funds for essential items such as female hygiene products, diapers demonstrate the strength of community ties this really kind of like indicates that when former system fails, informal network comes in where it becomes really crucial for survival. And like the interview really throughout the interactions with Amy, like it really kind of show how individual within the immigrant community face similar challenges, like fostering a sense of like a kinship among them. It really highlights how the shared experiences can create like an environment where individuals help each other to navigate this home healthcare field. And also the other one I focused on was the cultural values and beliefs, where Amy reflects deeply on the cultural values that prioritize family and well-being over individual needs.
Hmm.
I was really kind of connect to the family sacrifice, where she mentioned the experiences where family members often sacrifice their financial stability for the health of a member, where her Amy's father decision to spend part of his saving for medical care really highlights the culture beliefs that family health takes priority even at a financial cost.
Yeah. Yeah, it's pretty sad to see how much like family influence, although that can be a good thing, it's always a matter of like the benefits and the disadvantages.
Yeah, yeah,
The two key insights that emerged from what Jenny describes as Vietnamese American healing was that our healing is rooted in holistic and also traditions. She expresses that whenever she feels sick, she doesn't necessarily always resort to using medications or visiting the healthcare system. She says she says that our father's immigration trauma influenced his worldview, which dismissed mental health conditions that she struggled with. She expressed that during his hospitalization while he was sick before he subsequently passed away, she would prefer for nurses um, to perform the physical tasks and allow family provide emotional support. Some some symbols in her tradition would be the tiger balm, like I mentioned previously, and the eagle brand oil associated with like comfort and protection, the scraping with coin associated with releasing illnesses, and the loss of language she associates with loss of cultural connection.
yeah, thank you. I feel like that's always a struggle and challenge for all like people that
Hmm.
actually from immigrant community.
Yeah.
What I saw from here is for my insight was the holistic health as community centric, where the experiences share highlight the importance of the support in promoting the holistic health within the immigrant families. So during interactions with Amy and her family, it became evident that traditional practices and home remedies plays like a real big role in health management, where people often share knowledge about the herbal remedies and preventative care, emphasizing the communities that rely on collective wisdoms. The metaphor that I came up with, the circle of care, which symbolized the interconnectedness of community members and supporting each other's health. And
Mhm.
the other insight was the impact on the well-being, where kind of through Amy's conversations, I was kind of illustrate how societal stigma surrounding the government-assisted healthcare affects the mental and emotional well-being. We're
Mhm.
interviewing with Amy, like showing that many individuals internalize the negative perceptions about with using the free healthcare services.
Mhm.
This leads to reluctance in seeking care and reinforcing a cycle of poor health outcomes. Where metaphor I kind of thought about is the invisible wall, where represent the barriers created by the judgment, isolating individual from necessary healthcare. And
Mhm.
one items of meaning I kind of want to bring up here is the Harbor Remedy Kit, where small kit containing the common herbs and remedies used within the community. This item symbolized the reliance on the traditional knowledge coming from the generations and the community-centric approach to health.
Yeah. Yeah, it's funny because my interviewee, Jenny, she mentioned that they use scraping of the coin, which is like it's funny
Oh,
they
really?
so
Huh.
many similarities with like cultures. Like we just don't think of them at the moment.
Yeah. Mhm.
Jenny also mentions that she doesn't really have any clear taboo foods, like taboo foods that she should
Mhm.
eat in her
Mhm.
experiences, but it kind of shifts. What she refers to as taboo foods shifts
Mhm.
depending on which cultural lenses she uses. She says in an American cultural context, eating dog meat is considered taboo. But in our Vietnamese heritage, there has been like historical practices where people would sometimes eat their dog meat if they run out of food and they're not able to access other food items. Similarly, like organ meats, which is like the carcass of like a cow, which Americans would view as like taboo or undesirable to eat, is like a common dish in Vietnam. She emphasizes that what is considered taboo highly depends on what cultural perspective she's using to answer the question. She said some of the major like problems facing the Vietnamese community in terms of chronic health conditions is hypertension, hyperlipidemia, alcohol use in disorder. She emphasizes as being a really big one, pre-diabetes, diabetes, and a lot of cancers. She says that lung cancer is the most common because of high rates of smoking among the Vietnamese men, which doesn't really change depending on where they're located, either in Vietnam or in America. She kind of gave me the idea that it was more common in Vietnam than in the and than the people in America. Um, she also said that there's a pandemic of like medication misuse, especially of inappropriate use of antibiotics in Vietnam and malnutrition as well, because the government refuses to fund affordable foods. She said in defining like what chronic condition is in the US and what she feels is most rampant is everything under the sun. Jenny H. Personal Communication, November 5, 2025.
Yeah, thank you. That was really interesting where all the traditionals and remedies comes from like each like different cultures, like
Mhm.
where like Korean has our own culture remedies and like proper
Yeah.
medications that kind of go on with the Asian cultures too. But yeah, thank you.
Yeah.
Um, so moving on to like nursing implications where so as a professional nurse, I feel like it's really important to recognize the challenges faced by the immigrant family,
Hmm.
especially those related to the financial instability and limited access to healthcare. I
Yeah.
mean, like obviously many immigrant families struggle with the costs associated with healthcare, leading
Hmm.
to delayed Medicare care. Understanding this barrier can help nurses approach the care with empathy and support
Yeah.
also, especially with limited English proficiency, like can impede the effective communications, making it essential for nurses to utilize interpreter services to ensure patients understand their care options
Hmm.
and really building that relationship with the individual and the family from this community. Nurses should focus on the cultural competence, where it emphasized from the transcultural nursing our textbook from Macfarlane, where this understanding can help tailor intervention that respect and align with the patient cultural beliefs and practices.
Hmm.
And also establishing trust is essential, where nurses should be transparent about treatment options and costs, validating patient concern and experiences. This approach can help build rapport and encourage patients to seek necessary care.
Yeah.
And nurses should also advocate for the policies that improve healthcare access for low-income family. Understand these barriers can face inform advocacy efforts aimed at addressing these systemic issues.
Yeah.
And also the yeah.
Mhm. Yeah, no, that's
um
actually perfect. You
mhm.
kind of summarized what I was about to say as
Yeah,
well.
yeah.
I think that nurses should as well use open-ended questions to explore like the
Mhm,
cultural healing practices,
mhm,
dietary beliefs, or the use of herbal remedies. Even when
mhm,
patients like rely on, even when you like younger patients, English speaking
mhm.
patients, sorry, restart. Even when
Oh, you're
patients rely
good.
on younger, like speaking family members to translate, I feel like nurses
Mhm,
should still be aware that family
mhm.
members might face like problems conveying what the
Yeah.
patient is trying to say, and they might
Mhm.
underscore or over express what the patient is actually
Yep.
trying to convey. Um, they should also respect the role of family elders, acknowledge traditional remedies, and being sensitive to the different beliefs around health. I think that transcultural nursing is a very important one. Nursing should strive as much as possible to become culturally competent. I think sharing these highlights and discussing it amongst nurses of similar beliefs on how to give care would really improve the patient outcome while they're admitted.
Yeah. I do agree with you, Ade. It's really gonna improve our health outcomes. So
Yeah,
thank you.
thank you.